This is the lymphatic system, beginning on page 228 with the anatomy. Lymph originates in the tissue spaces around cells and travels in lymph vessels and through lymph nodes to a large vein in the neck where it enters the bloodstream. Arrows in the figure indicate the direction of lymph flow. Lymph contains white blood cells, lymphocytes, which help the body fight disease. The spleen produces lymphocytes and disposes of dying blood cells. The thymus gland stimulates the production of lymphocytes. Our terminology, we have lympho, this means lymph fluid. Lymphedema is accumulation of fluid in tissue spaces, causing swelling. It's caused by the obstruction of lymph nodes or vessels. Lymphadeno means lymph node or gland. Lymphadenectomy is the removal of the lymph nodes. Lymphadenopathy is disease of lymph nodes or glands. Lymphangio means lymph vessel. Lymphangiectasis is dilation of small lymph vessels, often resulting from obstruction in large lymph vessels. Spleno means spleen. Splenomegaly is enlargement of the spleen. And thymo means thymus gland. Thymoma is a malignant tumor of the thymus gland. The pathology for the lymphatic system: acquired immunodeficiency syndrome, known as AIDS, suppression or deficiency of the immune response or destruction of lymphocytes caused by exposure to human immunodeficiency virus or HIV. Lymphoma, malignant tumor of lymph nodes and lymphatic tissue. Hodgkin lymphoma is an example of a lymphoma. Mononucleosis, acute infectious disease with enlargement of lymph nodes and increased number of lymphocytes and monocytes in the bloodstream. Sarcoidosis, inflammatory disease in which small nodules or tubercles form in lymph nodes and other organs. Sarco means flesh and oid means resembling. Laboratory tests and diagnostic procedures: computed tomography or CT scan, X-ray views in the transverse plane for the diagnosis of abnormalities in lymphoid organs, lymph nodes, spleen, and thymus gland. ELISA is enzyme-linked immunosorbent assay, a test to screen for antibodies to the human immunodeficiency virus, HIV, which causes acquired immunodeficiency syndrome, or AIDS. And the Western blot test, a blood test to detect the presence of antibodies to specific antigens, such as the human immunodeficiency virus. It is regarded as a more precise test than the ELISA. Treatment procedures: chemotherapy. This is treatment with powerful drugs to kill cancer cells. Immunotherapy, using the body's own immune system to target and destroy lymphoma cells. And radiotherapy, also known as radiation therapy, treatment with high-dose radiation to destroy malignant lesions in the body. Next, we have abbreviations. AIDS is acquired immunodeficiency syndrome. ELISA is enzyme-linked immunosorbent assay, a test to detect anti-HIV antibodies. HAART, highly active antiretroviral therapy, and this is used for AIDS. HIV is human immunodeficiency virus. IgA, IgD, IgE, IgG, and IgM are all immunoglobulins or antibodies. MAC is Mycobacterium avium complex. This is a group of pathogens that cause lung disease in patients with depressed immune systems. And PCP, pneumocystis or pneumonia, opportunistic infection seen in patients with AIDS.